that's where we really wanted to find out what the social and health implications were of community dwelling older adults at the beginning of the pandemic, along with their formal and their family caregivers. So that was the start of this research project, and it really truly is a participatory action research project.
This is the Public Health Insight Podcast. Before we move on, it is important to note that the views expressed in this podcast are our own and do not represent any of the organizations we work for or are affiliated with.
In the previous episode, Gordon and LaShawn spoke with Anne and Justine from Age Friendly Peterborough about the distinction between social isolation and loneliness, its broader health implications, the burden on caregivers, and how the COVID-19 pandemic has created challenges for seniors living in community dwellings. In the second part of the discussion, Anne and Justine remain with us to share some findings and lessons learned from implementing several projects that foster the creation of an age-friendly community, creating more inclusive environments for seniors living in community dwellings. This is where we left off.
You know, what I'm hearing throughout this conversation is how important it is for us to develop specific strategies tailored to support, seniors living in our community to ensure that their needs are being addressed. And it sounds like Peterborough's doing a lot of great work around ensuring that seniors essentially don't fall through those cracks. And even though sometimes, depending on the restrictions during COVID-19, they often get left behind. So we've alluded to it several times throughout this conversation. You're part of the Age Friendly Peterborough community. So I'm wondering if you could share a little bit more about what are the high-level goals of this initiative?
Yeah, I can speak to a couple of the different goals. I believe there's 4 overarching goals of Age Friendly Peterborough specifically, and they align with the 8 World Health Organization friendly domains. So the one that relates to our research is that older adults are able to build and maintain relationships. So it relates to social isolation, social inclusion, civic participation, civic engagement. And there's also a piece on transportation, so older adults are able to get around the community. So there's all kinds of different projects that are going on to ensure that transportation options, whether it's public transit, public transit not just in the city, but in the rural communities as well, are being expanded. And there's 2 other goals.
Meeting basic needs, so that's the piece about community and health services and food and housing. And then the last one is around learning and contributing and growing. So that's that communication piece and civic engagement, where we try and do a lot of outreach and education and facilitate communication between the different sectors as well as with our seniors. And so it's really the building relationship piece that influenced our 3 main goals, 3 main aims of our research, which was to examine the health impacts of COVID-19 related to social isolation among our seniors and their caregivers, and then also to identify those promising practices, programs, and policies in our region, and look at how we can do some integrative knowledge exchange with our community partners, as well as more importantly, with our decision makers, because we found that the impacts were on the individuals and families, but some of the supports that were required were at not only the community level and the organizations, but at the governmental level as well.
Yeah, and it really is Age Friendly Peterborough that's enabled us to do this type of research and take this approach, because Age Friendly Peterborough is made up of seniors who are volunteers, senior-led organizations, senior-serving organizations, community-based organizations, businesses in Peterborough. It's all a very collaborative network.
Yeah, you mentioned this idea of this collaborative network that, are all focusing on these different important components that are often integrated and intertwined. It leads me to think of that idea, again, of age-friendly communities. And what are some of the important components to consider when you're talking about planning an age-friendly community?
There's so many, but when you think of an age-friendly community, it's not just that seniors are able to, maybe it's accessibility, it's not just that seniors are able to physically access buildings or outdoor outdoor areas, it's about anyone could access those, and it will affect everyone at the age. So someone who's maybe in their 20s now will benefit from those types of designs in the community as they age. So there is the piece on outdoor spaces, trying to make those more accessible, and as we've talked about before, making more programs for social participation available, and making that senior peer-led, so seniors leading those types of initiatives, but also creating intergenerational opportunities, because we have Trent and Fleming here, so students and seniors giving those opportunities to connect, and for the younger generations to learn from the older generations.
We've also been, again, because we live in a rural area, we have had to, and it's almost always a challenge for our rural dwelling seniors. So we've started a pilot program, and some of our organizations, the pilot program is a bus, and we also have organizations that have volunteers that will take them in their vehicles. And when that's not possible, then they try and figure out a way to go to the seniors. So those staff and volunteers, for example, with community care, during the onset of the pandemic, when seniors were asked to stay at home, instead of those volunteers helping seniors travel to appointments, they helped get food and groceries to seniors. Mm-hmm. So reaching out as opposed to using them for transportation in. And we're also really looking at innovative housing that will help mix those generations more and find meaning in their dwellings and make things much more walkable, where you meet those social, mental, physical aspects, as well as being able to access the services and amenities you need potentially by foot and with minimal barriers to that. And really creating avenues where people can civically engage, whether it's through mentorship programs or social programs or senior centers without walls where you don't need technology. We're really trying to look at how we can reach out to seniors, to those particularly more vulnerable seniors. And we are taking lessons from our Indigenous community because they did seem to rally and show that resilience. And I think we need to highlight some of those situations. And we're doing so even now as vaccines roll out, in that the First Nation organizations are helping seniors book those appointments, and members of their whole community actually, and facilitate the transportation now to the clinics. So it's what we've learned from the beginning of the pandemic, we're now translating now that we're 15, 16 months into it.
So it sounds like then the overarching goal of all of this is to foster, social inclusion. Seniors might feel as they age, they become kind of a peripheral part of the community. And what an age-friendly community aims to do is to have all those pieces integrated together to have them still feel a part of the community in all those aspects. And also recognizes that they have inherent challenges that are associated with, ages and chronic diseases, and address those in parallel with the other kind of basic needs that are happening. Did I get that right?
Exactly. And we're also trying to engage our seniors as well in the dialogue with our decision makers. So we've shared our results with our elected officials, as well as heads of our organizations of the Ontario Health Team. So we're just in those beginning stages of creating stronger relationships with our decision makers so that our more vulnerable populations are really engaged and empowered, shaping the future that they want to participate in.
That all reminds me, like this whole idea of this age, friendly community, and we all are talking about, it's for everyone. Everyone has a role to play. And that's why I like that idea of almost a multi-generational approach, understanding that, the issues of one generation are going to be affecting other generations to come. So we all have some stake in these issues that we're talking about. And when it comes to public health, a lot of it comes down to framing and how oftentimes we don't think about, you might think about, hey, this is an issue for them. I'm not old, so I don't have to worry about this. But that's not true, because the actions that we're doing now are going to be affecting us when we get to that point. So we all have to work together. And that's why I like this idea of this whole network of all these collaborations, whether it's, the seniors getting their perspective, working with government officials, working with our local public health units. Everyone should be involved because this is definitely a public health issue that's affecting everyone.
Awesome. And if we want to look at the selfish framing approach, it's in our best interest economically if we have seniors aging in place. So for those who maybe don't really care about multi-generational and they don't really see the value in that, it's a lot of healthcare dollars that are spent when seniors have to transition from independent living to long-term care institutions. So I thought I'd throw that in there as well. So under the Age Friendly Peterborough Advisory Committee, as it's called, it's clear that there's a lot of, and you've described a lot of them today, there's a lot of ongoing projects to support seniors in the community. And I wanted to hone in specifically on, you mentioned there's 4 essential working groups or pillars, and I wanted to focus specifically on, dig a bit deeper into the social inclusion piece of that. So there's a particular project that is well described from the material that you shared with us that's called Social Isolation to Social Connection. So I'm wondering if you could just share a little bit more about what that specific project entails.
So this was the project that was spurred from the pandemic. It is housed in the Building Relationships Working Group, and this was the outcome. Social Isolation to Social Connection was the outcome of our weekly teleconferences with multiple agencies, co-led by Age Friendly Peterborough and Public Health at the onset of the pandemic. And that's where we really wanted to find out what the social and health implications were of community dwelling older adults at the beginning of the pandemic, along with their formal and their family caregivers. So that was the start of this research project, and it really truly is a participatory action research project, as Justine was saying, because we have students involved, young students, we have middle-aged adults working out in the community sector, we have older adult volunteers and caregivers, and then we also have really very old. I think our oldest participants were in their late 90s, as part of the project. And our organizations came together and went through research ethics. So really reached out to their more vulnerable clients that they served, who they thought could share a good story about those implications. So they helped in recruitment, they helped in framing the question, they helped in stating the aims of the projects, which were, really to find out what those impacts were, but also what the promising practices, programs, and policies were that could not only address social isolation now, but potentially mitigate it, in the future as well as we unfold. So that's kind of a broad overview of what the project was. So we conducted interviews with 31 participants through Zoom or phone, because it all had to be done virtually, of course. And those were all transcribed. Justine was the lead on all of that work that happened. And we also wanted to see what were the implications of various documents that we analyzed that related to social isolation and the pandemic. So it was the synthesis of the analysis of the documents as well as the interview findings that we brought back to the participants in a virtual Zoom focus group that really honed down on agreement of the major findings around individual effects, which on seniors was largely around mobility. And for all the participants, the seniors, the family caregivers, and the formal caregivers, it was mental strain and really altered social relationships that, for the most part, made it more challenging. Some families needed to alter their where they were living to provide care, and in some cases it strengthened their relationship. But for the large extent, it was really those altered social relationships, mental strain, and physical immobility that all by and large made their chronic physical health worse as well.
Yeah, so you mentioned we had 3 parts to it, and just described the research study piece of it. And then you also mentioned that we were looking for promising practices. So we did a scan for promising practices being used in Canada, Canadian communities, and in other countries, and assessed the strengths of those and if they exist in Peterborough or should they exist in Peterborough and how can that be introduced. And then we also did a piece from the other health and housing study to look at what types of housing models exist that can help address social isolation.
I'm very curious about that particular piece as well. Describe this sort of the importance of affordable. I know people who rent homes too are also affected as well. So let's talk about how this phenomenon specifically affects those seniors that are wanting to remain in community dwellings.
Sure, yeah. So, affordable housing affects everyone, right? Whether or not you're renting or whether you're trying to buy a home. But in Peterborough specifically, and this is prices before the pandemic, and that certainly had an impact on it. But in terms of home ownership, the price of homes has gone up about 150,000 in the last 4 years. Well, it was 2014 to 2018. So that's a massive jump when you think about rents, rental prices. In Peterborough, it's cheaper relative to places like Toronto or Hamilton. But the types of housing, when we talk about seniors, when you rent, you also might need physical accessibility pieces in that, and then that can become more expensive depending on the type of housing you're looking for. And then the types of housing that you want to look for when we're talking about social connection is oftentimes not living on your own. And so you want to be able to, whether or not you build a co-housing community, which is an intentional community meant to foster social connection, and everybody has their own unit. So you're still technically living alone in your own unit, but it's built in a way where you have shared common spaces. So it might be gardens, or it might be a shared center where you can, you organize weekly meals, monthly meals, these types of things. So co-housing was one of the types of options that we identified to enable social connection in Peterborough. So there's already a co-housing project in Peterborough, and there's one in Hamilton, and they're kind of popping up all over. But the difficulty with co-housing is that it's not always affordable because it's a big buy-in to contribute to building the community. And they're trying to introduce ways to make 30% of their units in a co-housing community affordable, so that more seniors, low-income seniors who are also at risk of social isolation, because income is a factor in that too, to make them able to buy into these units and to access housing, first of all, that they need, and then the social connections as well. And then we also identified different things like home sharing. So that's where one person might own the house, and then they rent out rooms in the house. So kind of like student housing, but for seniors specifically, and it might be all seniors living in the house. So there's a group called Senior Ladies Living Together in Peterborough, and it was started by Pat Dunn, and she has a Facebook group, and that's how they originally started connecting people who wanted to rent a house together. And so that's all seniors living together, but there's also, it started as Toronto Home Share, and it's now Canada Home Share, and it's an intergenerational home share program between students and seniors. And so students were matched with seniors to live with them. And I know in Hamilton they had symbiosis. So that's a student home sharing program. And with that, it's either you can pay higher rent and offer less services to the senior, or you can pay lower rent and contribute more to their, whether it's grocery shopping or taking them to appointments, doing more house cleaning, those types of things. So there's all kinds of different housing options available to make housing more affordable to seniors and to students and to all the groups that are affected by the prices of housing, right? And then when you bring in trying to build housing that facilitates social connection.
Fantastic. Yeah, that, the housing piece is so important, and, it's one of the most important things, because if you don't have, a place to call your own and, have your own belongings and be able to ground yourself in a protective and safe environment, it's very difficult. It's a very difficult situation. So, that component I think is super important in the grand scheme of things when we're talking about this specific research project. And further to that, you also mentioned the idea of getting the perspectives from the caregivers and the seniors to really hear what's affecting them, from their own words, by using, this specific approach where, it's a participatory action approach where along the whole process, they're helping and framing these different questions and looking at this information, and you're feeding it back to them and you're working on it together, which is totally appreciated in public health when you can involve the people that are actually being affected by these issues, which more organizations should definitely be doing. But that brings me to the questions. We're talking about all these findings and these important findings that you all found. And I understand that you presented some recommendations, about 10 recommendations, and you've also identified almost 40 promising practices and strategies that can be implemented to prevent and mitigate social isolation amongst seniors. So let's talk a bit about some of the few that stood out.
I think at a local level, going from local to provincial level, I think one of the main things that came out was our seniors and our caregivers were asking for a real, transparent, respectful, two-way communication in that circle of care. In particular around the pandemic information. So infection prevention and control, and what do you do with PPE, and now about how can we access vaccines and book them, and what does it mean as we reopen. Another highlight was that they really wanted means to access community-based resources in a timely way that they needed. So how can we do that in a way that puts more control in the seniors and families and caregivers' hands? For example, they may procure the services that they need, and it's just that they need to be affordable and not rationed as much as they are. They also saw the merits of technology to support virtual care, as well as that social inclusion piece as well, but the importance of low-tech outreach was really important for people who did not have that access to technology at a local level. And Justine, I don't know if you want to talk about at the community level, some of those knowledge exchange activities that we're looking at.
Yeah, so we're really into the knowledge exchange stage of our translating research to action into participatory action research approach. And so the podcast here is one great example of the way that we're trying to get out our findings and our research to not just academics, but anyone, and not just people in Peterborough, right? Because social isolation is an issue everywhere. So we're trying to expand that and taking different approaches to knowledge exchange. And we're also writing a story for a local newspaper here in Peterborough. It's called Peterborough Currents. And then of course we're writing manuscripts to be published in a journal, but just taking all of these different approaches. And there's the Trent Center for Aging and Society, and we have kind of like a repository of everything, all the knowledge exchange pieces that we have going on there. And there's videos about our study on that website as well. So just taking a multi-pronged approach, trying all kinds of different formats to not just reach academics, but to reach community members, more seniors out in other communities, students, all kinds of different audiences.
And to build on what Justine is saying, all of our working groups in Age Friendly Peterborough are identifying decision makers that they want, and seniors, to be part of responding to those recommendations. And even at a provincial level, some of our members are advising, for example, the Provincial Geriatric Leadership Office around systemic addresses and indicators that primary care providers, for example, can use to provide more collaborative, coordinated care, and provincially being a part of advocacy efforts to really enhance that home care sector around equitable, fair incomes, but also reducing the systemic structural barriers to that two-way communication that people are asking for. And I'm starting to be optimistic about it with the Ontario health teams, in that they're a regional approach to solving, to providing care across the continuum. So I'm optimistic, cautiously optimistic, that there will be improved communication that's more client and family centered and involve a larger circle of care that include those social determinants of health and things like social isolation, if we want to mitigate things further upstream.
I'm just reflecting as you're mentioning this, the undertone of that is sometimes the easiest way to communicate something like a social media post or what have you is not the best way to reach some of those clients who, seniors living in the community. And we have to be more mindful about how they would like to receive that information in a form that's easier for them to act upon. And that's something that I'm thinking about now. Like, sure, yes, I communicated, I did it, but it's like, did they receive the message, and is it presented in a form that is readily available for them to act on? So that's a personal reflection I'll take out of what you're saying as well.
Yes, and who, where they might naturally go. So seniors might naturally go to their primary care provider, but they've been delaying those visits. So eventually when they get into their primary care provider, they can talk about social prescribing and referring to some of the more social programs that might support them, and make those linkages. So that's one of the initiatives that we're trying to facilitate as well.
So on that note, you mentioned social prescribing. What is that exactly, and do we know how effective that strategy is?
It has been shown really quite effective, and we started at small scale here in Peterborough, but an example might be a socially isolated senior goes into their primary care practice and they have trouble navigating the system, and they might need rides to go to their primary care provider or exercise classes, and that primary care provider would say, here's a prescription to the YMCA, for example, or exercise classes that are run at one of our senior centers, and here's a prescription to call community care to access rides to those outdoor exercise classes that are restarting.
So basically, when a patient approaches or goes in for a patient visit, not everything can be solved essentially medically, and it incorporates that understanding of social determinants of health, how social support networks can be a protective factor against social isolation, and then when a physician is involved in prescribing that, I think it holds a little bit more weight as well, or prescriber prescribing that social prescription, and then they're more likely to act on that, and that goes into that piece that you mentioned earlier about two-way communication.
And the Peterborough Family Health Team also has navigators to help those that even have more struggles to access those services, to follow up with them. So they are aware that the social prescribing has happened, but they might need to follow up with them to see whether they connected with the Alzheimer's Society or community care or the senior centers, and if they need volunteer visitors to help with the transportation, that kind of thing. So it's even an extra little piece of safety net, particularly for those seniors who don't have a very large social network.
Right, fantastic. I just out of curiosity, so what are the next steps for your research in your group? What would you think the next step is? Like, I know you're having these knowledge translation meetings and you're going back and having these calls and, disseminating this information. What is the next step from your end?
Well, a very next step from our end that's happening is that we're having an open vaccine clinic, and we're actively working collaboratively with these same organizations that are part of Age Friendly Peterborough, where they can call our network members to book appointments, because the booking of appointments has been somewhat challenging. And we have noticed that it works when seniors work collaboratively with people they know and reduce those barriers that may be the technology, it may be the transportation. So that's just a real tangible outcome of something we're doing. But on a broader level, more community-wide level and systems level, we are waiting for these discussions with our working groups to address the recommendations, both having those discussions with the seniors as well as the decision makers. But on more urgent issues, we work with what we can do.
And one example of one of the recommendations we had was about ensuring and like promoting that there's supportive housing options for seniors. And so we have a housing task force you mentioned that I'm on, and so we convene and we have people from all kinds of different housing projects in Peterborough, and we are identifying ways that we can support those projects as a group. So whether it's ensuring that seniors are aware that like a home sharing program is coming to Peterborough, and that it's going to be at Trent University, like partnership with Trent University, or whether it's we can support a grant that they're writing to get more funding to do their housing and ensure that it's built, or locating, identifying sites.
Right. So we've talked a lot about affordable housing, social isolation, physical and mental health for seniors living in community dwelling. So I wanted to ask you, tying all this together, what do you want people to know from listening to this conversation? What are your key takeaway messages? And I'll give each of you an opportunity to express them. So Justine, while we're at it, I'll throw that over to you.
Sure. So I think because of the pandemic, a lot of people have experienced feelings of isolation or loneliness. And so it's, reflecting on those experiences that you've had, regardless of what age you are, what gender, like where you're located, rural, urban, all of these different pieces, and thinking about, how you can help your neighbors and the seniors that in your community. Maybe it's in your building, your neighbors next door, in your family even. So thinking about how you can, make more connections with them, and also ways that you can learn from them, and you can become more socially connected through those types of relationships. So just thinking about, the people in your community that may need those little pieces of connection and those little pieces of help, and the ways that you can do that individually, because it doesn't always have to be, high level. It's our government that has to do it. Individuals can make a difference as well.
I think one of the main takeaways for having investment in community collaborations and networks before the pandemic hit was really helpful in terms of community resilience and being responsive to those more vulnerable. And I think that participatory action research lent itself as a good methodology to really uncovering those more vulnerable voices and, laying a path for discussions with those who are making the decisions that are impacting the populations. So I think as a method, it's useful to invest in those community coalitions, even when we're not in a crisis, because we see their utility during a crisis, and that many of our government restrictions have really placed a primacy on that physical health. And I think the next soliloquy of this pandemic is going to be the mental strain that we've touched on the tip of the iceberg. And I think as we reopen, we really need to think about how we can reopen justly to address those who have been more disenfranchised and more affected. I think of particularly our caregivers that are marginalized, as well as our socially isolated seniors, but also those younger generations who have been really affected, their income has really been affected. And how can we promote that intergenerational approach to becoming, we'll use the term age friendly, but it's really more inclusive approaches to developing and supporting our communities as we come out of the pandemic.
Fantastic. This could go on and on. I'm really enjoying this conversation, learning about the specifics. A lot of times we know in public health, high level, what the problems are, where they exist, where the gaps are, but it's just exciting to hear that there is work actually being done on the ground. And that piece about that teleconferencing piece, it took me, I think, the third time mentioning, you in real time, you're constantly having conversations, gathering feedback. It's not 5 years from now, we do the research, disseminate it, figure out if the research was valuable or not. You're iterating something that might have been on the table 2 weeks ago based on the evolving needs of the community. It seems like you're open to evaluating that to see if it's something that's still useful. So that, I think that was really refreshing, and to understand that this is something that has to be a daily ongoing thing, not just a project with a limited life cycle. So I'm really happy that you were able to come on and share a little bit about that.
They can always visit our Age Friendly Peterborough website if they're interested in finding out more, or the Trent Center for Aging and Society. Our contact information is on both places. And whether you're a senior or a youth or a business person or a politician, everybody's got a spot at the table.
Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our content and would like to stay up to date, follow us on Instagram, Facebook, Twitter, and LinkedIn. To learn more about our community initiatives and how you can support us, visit our website at thepublichealthinsight.com. Join the PHI community, and let's make public health viral.